feeling constantly tired, struggling to concentrate, or dealing with dizziness and headaches. Over 30% of the world's population experiences these symptoms. The cause of these signs is anemia. Stay with me until the end of this video as we dive into important and essential information about anemia that everyone needs to know. Hello and welcome. I am Dr. Muhammad, and in this video we are talking about everything you need to know about anemia. What causes it? How to spot the warning signs early, and most importantly, how to treat it. We will also know how to confirm the diagnosis by a simple test. Anemia occurs when your red blood cells are either few or cannot functioning well, leading to reduced oxygen level in your body. So, what exactly red blood cells do? And what happens if they decrease? To understand this better, let's simplify it. Imagine that each red blood cell is like a bus, and hemoglobin is a group of workers responsible for carrying oxygen and getting in these buses. Once the bus is full of oxygen, it moves through the body, delivering oxygen to cells. If we don't have enough buses or workers, less oxygen will transport it to the organs. And as we know, oxygen is important for your body to perform essential functions. So when oxygen supply is reduced, it leads to symptoms like fatigue and poor concentration. Now let's talk about the causes of anemia. Red blood cells are produced in the bone marrow, and each second your body produces about 2 million red blood cells. Each cell lives for about 3 months before it's broken down by your spleen. The process of production and breaking down is balanced, so that the same number of the red blood cells produced equals those being destroyed, and any disruption of this balance can lead to anemia. So there are 3 main causes of anemia. First is reduced production of red blood cells. Second is increased destruction of red blood cells. Third is loss of blood cells, such as bleeding. At first, let's see the factors that reduce the production of red blood cells. Number 1, not getting essential nutrients from your diet, such as iron, folic acid, and vitamin B12. Number 2, bone marrow diseases, such as lupus and rheumatoid arthritis. Number 3, other conditions, such as kidney disease, hypothyroidism, and cancers. Number 4, genetic disorders that affect the red blood cells production. However, other factors that increase red blood cells breakdown include: Number 1, autoimmune diseases, or diseases that affect spleen and liver. Number 2, blood loss from injuries or from heavy menstrual bleeding. Number 3, genetic disorders, such as G6PD deficiency and thalassemia. Now that we understand the causes, let's look at the early signs of anemia. The first sign to appear is fatigue and difficulty concentrating. The second is pale skin and cold extremities. Third is dizziness, especially when standing. Fourth is shortness of breath and chest pain. Fifth and lastly, rapid heart rate. Anemia can be diagnosed with a simple test called CBC, or complete blood count. The key marker is hemoglobin level. Normal level is above 14 for men and above 12 for women. If your levels are lower, you may have anemia. Treatment of anemia depends on its severity and cause. In some cases, improving your diet and taking supplements such as iron, folic acid, and vitamin B12 is enough. In severe cases, blood transfusion may be necessary. If you are interested in learning about the best foods and diet to treat anemia, let me know in the comments below, and I will cover it in the future video. With that, we have come to the end of our video. I hope you found it helpful. Stay healthy until I see you in the next video.